Hello everyone, I am Dr. Archana, working as a consultant nephrologist at Renal Hospital, Kompally. Today I am going to start with another topic, that is renal replacement therapy, means kidney substitute treatment. So let us start with a myth again. Dialysis is a cure for kidney disease. This is what is a myth which is perceived in the society. So dialysis is a very important type of renal replacement therapy, but it is not a cure for kidney disease. It is just a substitute for your kidney function. Let us understand more about this now. So whenever the kidney function drops below certain level, that is CKD stage 5, the glomerular filtration rate drops below 15 ml per minute per 1.73 meter square. So that time the patient is considered for dialysis. There are other indications also when the dialysis needs to be started, like high potassium in the body, high acid in the body, or high blood volume or high fluid overload we call it. So that time also the dialysis needs to be done. Advanced kidney problem can have effect on the brain as well as on the heart. These are also the situations where the dialysis needs to be started urgently. There is another condition by name acute kidney injury, which happens usually in hospital patients because of some sepsis, that is severe sort of infection in the body, or there are other reasons for it. So in this scenario also the kidneys stop functioning, but this stoppage of functioning is of a temporary. So that time we need to support the kidneys. So dialysis, or the renal replacement therapy can be given for the temporary kidney failure purpose also, as well as for the permanent kidney damage like CKD or end-stage renal disease. Normally, kidneys remove the toxins, extra water from the body. When they are not able to do so, we need to do it externally by using some other means. Dialysis is one of the modalities of the renal replacement therapy, while the second modality is the kidney transplantation. Let us start with the dialysis first. What is dialysis? Dialysis is taking out the toxins, extra water from the blood of a patient whose kidneys are not working up to the mark to remove all these products. So we need to plan it ahead when you want to start the dialysis for the patient. But many of the times it may not be possible and it is done in the emergency settings. So there are three important components of dialysis. One is the access. So as the blood is to be removed from the patient's body, we need something to take out the blood out. The second thing is the artificial kidney, where the blood filtration will happen. And we need the third component, which is the special type of fluid which is called as dialysate fluid, which is with certain kinds of electrolytes in particular proportion. So these three are important. There are two types of dialysis. One is hemodialysis and the second is peritoneal dialysis. Let me tell you about the hemodialysis first. Hemodialysis, as the name says, it is related to the blood. So hem means blood and dialysis means we are purifying it. So we are doing the blood purification. Directly the blood is taken out from the patient and then it moves in the artificial kidney and then again returned back to the body. Once we decide to start the patient on dialysis, first thing is the access, like from how we will take out the blood from the patient. There are two common sites from which the blood is taken out by using a small needle which is called as dialysis catheter, and there is a soft tube which is attached to that needle. So this needle or this catheter is placed by giving local anesthesia in the neck vessel or in the leg vessel. So from this soft tube, the blood comes out of the body at some particular rate. Usually 300 ml per minute is the blood flow required to do the dialysis effectively. So once this blood comes out of the body, it moves through a artificial kidney. Artificial kidney is a cylindrical tube-like structure. It is little big, and the blood, there are small capillaries which are placed inside this cylindrical structure, and the blood flows through these capillaries. There is another, as I said, there is a dialysate fluid which runs in opposite direction of the blood, and there is an exchange of the toxic material from blood to that dialysate fluid and the required electrolytes from the dialysate fluid to the blood. So this keeps on happening as the blood flows through the circuit, and the body loses all its toxins, extra water to the dialysate fluid, and the patient gains good electrolytes from the which are needed for that particular patient from the dialysate fluid to the blood. And again this blood is returned back to the body by the tube which is attached to the patient's blood vessel. When we talk about the dialysis, there are also other types of dialysis like SLED, that is low efficacy dialysis. That is SLED. We call it SLED when the patient's blood pressure is on the lower side. Usually this kind of dialysis is preferred and it is run in the bedside in ICU. The other special type of dialysis is called as CRRT, continuous renal replacement therapy, which is done in critically ill patients whose blood pressure is very low and who cannot withstand the conventional hemodialysis. So these are some special types of hemodialysis which are done in the hospital setting. When there is a CKD stage 5 or end stage renal disease, the patient is typically asked to visit the dialysis unit 2 to 3 times a week for 4 hours session each time. So this dialysis happens over 4 hours in hospital under the supervision so that we can monitor the blood pressure, the electrolyte disturbance, any other complication like vomiting or leg cramps which can happen during this process. Once the dialysis, there is another myth which is attached to dialysis, like it is a very painful process. Most of the patients will not get pain because every time we are putting the tube in the neck or in the leg, there is a local anesthesia which is given. The other type of dialysis access like AV fistula, from there also when we are pricking the needles, only that prick will be there. Otherwise, throughout the process, patient will not face any pain during the dialysis process. So there is no need to fear about the pain during dialysis. The other type of dialysis is peritoneal dialysis or abdominal dialysis. Similarly to the hemodialysis, we have a peritoneal cavity, peritoneal membrane, which has a network of capillaries like small blood vessels throughout the peritoneal cavity. And these blood vessels are studded with the toxic material in advanced stage of kidney problem. So in this situation, there is a small soft tube is placed surgically in the abdomen and a special type of dialysate fluid is inserted through that tube inside the peritoneal cavity. Now there is a membrane with many capillaries with toxic material and extra water, and there is a special fluid in the peritoneal cavity with which is called as dialysate. So the exchange happens at this level also, and the toxins as well as the extra water or extra fluid from the body is taken into the peritoneal cavity in the fluid, and the required electrolytes are transferred from the dialysate fluid to the peritoneal capillaries. So this exchange happens. It is quite similar to the mechanism is almost similar to the hemodialysis. The exchange is happening to take out the toxic materials. There are types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, that is CAPD, and the other is APD, that is automated peritoneal dialysis. CAPD can be conducted by the family member itself, or even the patient can it can be done by the patient himself or herself. So there will be a training which will be given to them to know how to handle the catheter, how to give the fluid inside, when to take it out, and how the exchanges are carried out. Usually for CAPD, almost 3 to 4 exchanges per day will be carried out to achieve maximum clearance of the toxic material. So this type of dialysis will be done on everyday basis, peritoneal dialysis. The other type in peritoneal dialysis is automated peritoneal dialysis, where the exchanges are done not by the patient or by the family, but by a cycler, by a machine which is called as cycler, and patient while going to the bed will feed all the information given by the doctor. He will go to sleep and the machine does the work through the fluid pushing in and taking it out. So the exchanges happen overnight. So these are the two important types of dialysis. The second modality of renal replacement therapy is the renal transplantation or kidney transplantation. Kidney transplantation can be done in two ways. One is the live kidney transplantation, while the second one is the cadaver kidney transplantation. In live kidney transplantation, the patient's relatives will give the kidney, so that the matching and all will be done before giving the kidney. While in cadaver transplant, any patients who are having who have met with road traffic accidents and having brain dead, and they want to donate the organs, so in that situation those kidneys are taken and they are placed in the needy people. So these are the two types of kidney transplantation. To know more about the dialysis therapy as well as about the kidney transplantation, please contact your nephrologist as required. Thank you.